Cool. Well, I guess we'll get into it. So, Nick, thanks so much for being here with me. I appreciate it very much. Would you mind starting off by just giving us a quick introduction to who you are?
Yeah, I'm Nick Evans, and I've been at Shepherd Center in Atlanta, Georgia for almost 14 years now. I've kind of I have a various circuitous background. I got an undergraduate degree in exercise and sports science from the University of Georgia,
Go
then
dogs.
left. And then moved to Australia and acquired a master's degree in human movement studies. And after that degree, I came back to the United States and ended up at Shepherd Center working in an outpatient program called Beyond Therapy. It just started. It was maybe a year old or just under a year old at the time that I arrived there, and was fortunate enough to get a position as a clinical exercise physiologist in this outpatient rehab program. And so I've pretty much been working in the Beyond Therapy program, which is the name of this outpatient program that I've been involved in. I've been in the program since I started Shepherd Center, and about 6 years ago, I transitioned to attempting to acquire my Ph.D. in applied physiology at the Georgia Institute of Technology, where I know you're very familiar with the program. So,
Yeah,
and have
very much so. So
successfully.
soon to be Dr. Evans. Very
Yeah,
cool.
yeah, I hope so. I'm working on it. Hopefully by the end of this year. Yeah,
Yeah,
yeah. But yeah, so transition to working towards my PhD, and
mhm.
the Shepherd Center has a spinal cord injury research lab. So I was fortunate enough to be able to work on my dissertation research in the spinal cord injury research lab under Dr. Adele Field-Fote, and I've been doing that combination of outpatient rehab and PhD and research. So that's kind
In
of my
clinical
background.
science. Yeah. And Dr. Phil comes by way of the Miami Project. And so she's
Yeah.
a titan in the field, if you will, and studying individuals who have spinal cord injury and working on exercise-based intervention strategies. So
Yeah,
I guess,
absolutely.
yeah, before we dive into those bits of your science and what you're really interested in doing, I'd really like you to maybe just describe a little bit about Beyond Therapy. It's not your sort of canonical outpatient therapy program, right? Just by nature of you being there as an exercise physiologist is a little bit different than most outpatient programs. And so, would you mind maybe just tell me a little bit about Beyond Therapy itself and maybe where gets situated in the scope of recovery from inpatient, sort of standard outpatient, back to sort of community engagement?
Yeah, yeah. I mean, it's a great question, and definitely takes me back to quite a few years ago. So the Beyond Therapy program started in 2005, and
Okay.
I arrived at Shepherd Center in 2006. But the core rationale for Beyond Therapy at the time was there was a need beyond traditional outpatient therapy for ongoing neuro-rehabilitation that just wasn't being offered beyond what would traditionally be provided by a place like Shepherd Center or a Craig Hospital
Hmm.
in Colorado, or some rehab center. And so a clinician and some other staff within Shepherd Center branched out and collaborated between physical therapists and exercise physiologists who were already in the center working kind of in a wellness model, just a general health and wellness model. Um, the two clinical disciplines, physical therapy and exercise physiology, collaborated together on this new and kind of emerging program called Beyond Therapy. And basically, it's a self-pay program
Hmm.
where individuals who feel like they'd like to continue to work on some intensive rehabilitation post neurological injury, they can continue to still access resources through Shepherd Center in a outpatient-like model. But yeah, it is very non-traditional. It started off very non-traditional. And at the time, there really weren't many, if any, programs that were combining the two clinical disciplines. So,
Okay.
it was really clinical exercise physiology up until that point, as I'm sure you already know, but was primarily dedicated to cardiovascular
Yep.
rehab,
Yep.
pulmonary rehab, respiratory rehabilitation. Yeah. So those were kind of like some of the primary areas where you might find a clinical exercise physiologist, and they're just it would be unlikely to find yourself as a clinical exercise physiologist in a neuro-rehabilitation setting or
Why do
working.
you, yeah, why do you think that is though?
Um, I don't know that. I mean, there are many clinical disciplines.
Hmm.
In physical therapy, pretty much had the bases covered, I would say, in terms of what was being offered in traditional rehabilitation. Um, with a focus on recovery of function
Sure.
and recovery of activities of daily living. But then there started to emerge a fair bit of literature, some of which I've heard you discuss, previously on some of your podcasts about, the necessary number of repetitions or the necessary underlying training parameters that would be required to maximize someone's recovery of
Hmm.
function after, a neurological injury. And so I think there was a recognition that exercise, beyond just activities of daily living and just going through, task-based activities, was necessary for optimizing recovery of neurological function and motor function, sensory function. But
Hmm.
so exercise physiologists are just positioned well because they have a strong understanding in the effects of exercise on human physiology. And I think that in the past, as a discipline, it just wasn't um, the various parameters that you can manipulate as an exercise physiologist and maybe the scope of knowledge just wasn't needed, maybe, or acknowledged, or felt like it was necessary. So anyway, I think it was a growing, I think it's a growing, emerging scientific literature,
Hmm.
which started to emphasize high volume training. You need a lot of repetitions and also the intensity of training. So manipulating training intensity and progressive overload and all of the principles that you really focus on as an exercise physiologist and
Sure.
wanting to manipulate someone's physiology in their system. But
Yeah, I very much resonate with that. I think it's oftentimes people don't treat individuals who've had neurologic injuries like athletes, and I often kind of take that perspective where, hey, there's a lot of training stimulus that we have to do to actually induce a positive change, and we need to be able to monitor when that stimulus has reached a critical threshold, and we need to know like when to back off to supercompensate, and these sort of principles that are so ingrained in that performance literature. I think they haven't really been fully adopted in the neurorehabilitation world. And I think exercise physiologists are perfectly tuned or perfectly situated to kind of help sort of let some of that information, some of that knowledge seep over to hopefully optimize outcomes in neuro rehab. So I think it's yeah,
yeah,
that's my kind of my 2 cents there about that.
yeah, I agree 100%. You actually verbalized that much better than probably I did. I probably rattled on a little longer, but this is not, and that's not a none of this is any kind of slight on physical therapists because and
No.
their knowledge base, because I
Yeah.
know that's your background. But physical therapists are limited in what they can do especially when you're based in an insurance based model.
Yep.
They're limited in the time they can spend with patients. They're limited in the types of activities they might do because there have to be insurance reimbursable activities.
Yep.
And so when Beyond Therapy came along, not only were we, adding a new or another existing clinical discipline that might bring some new information to the table, but then because it's self-pay, we could work on whatever we wanted to work on that we
Mm,
felt was relevant and specific to the person's goals. So if the person could no longer receive traditional therapy through insurance to help them work on recovery of walking function, we could absolutely do that in Beyond Therapy,
yep.
because they're paying for a service, and if we felt like there could be some value in them continuing to improve their walking function, for example, then we could do that. So anyway, I just wanted to add
Mhm.
that piece to the
Yeah, yeah,
equation.
yeah, yeah, yeah. And of course, this is by no means, as you mentioned, supposed to be a critique. Really, I think
Yeah.
you're exactly right. There are certain constraints that are applied to certain services, whether it's PTOT, speech language pathology, you name it. There's scope of practice, of course, and then of course all the other happy constraints. We'll call them administrative constraints that will impair someone's ability to do this. So it sounds like you kind of at Beyond Therapy, you have a bit more freedom. Do you find that when you're working with the physical therapist or even your patients one on one, you're able to be more like goal directed based on what that individual wants? You don't have to kind of check these boxes, or what's your experience so far been with that?
Yeah, yeah, absolutely.
Okay.
So I think that is one of the great benefits of a
Okay.
program like Beyond Therapy. And I think it's important to say that, Beyond Therapy now, what is it, 18 years or 16, sorry, 16 years
Hmm.
later, um, is not the only program like this now in the country. I
Sure.
mean, there's been many, many programs that have emerged as a result of some of the science that we put forward, based on outcomes that we've captured, but, based on other things as well. But yeah, absolutely. I think one of the great benefits of a program like Beyond Therapy is that we're very goal oriented.
Hmm.
We're absolutely goal oriented. And so we have the opportunity to work on practically anything anybody would like to work on in terms of their recovery, in terms of specific goals that they might have. I mean, and we've had individuals that cross the full spectrum of functionality and levels of injury and types of injury.
Sure.
So, whether it's an individual who just wants to brush their hair again independently, or whether it's somebody who wants to run again and compete in a 10K, or complete a 10K road race, maybe here in Atlanta in the Peachtree Road
Hmm.
Race. So we've seen the full spectrum of functionality, and a beautiful thing about Beyond Therapy is that we have the capacity to work on a broad spectrum of goals for individuals who might
Sure.
have suffered a particular injury.
Yeah, and actually, on that note, I mean, in your day-to-day sort of work there at Beyond Therapy, the Shepherd Center, what's a typical day look like? Who do you work with normally? And tell me a little bit about what that sort of patient population looks like. Is it a diverse population? You mentioned that you're working with individuals with spinal cord injury, but is that kind of your focus? Or yeah, tell me a little bit about your day.
Yeah, well, so the way the program is organized, currently we have two physical therapists,
Okay.
and we have about approximately 12 exercise physiologists. So
Okay.
we have a group of exercise physiologists. We have two physical therapists, and we work in teams.
Okay.
So we have, each of the physical therapists has, half of or approximately half of the exercise physiologists who they work together in
Okay.
teams. And then within those individual teams, those are even broken out so that you end up having one physical therapist and one exercise physiologist assigned to every patient or client in the program.
Okay. Interesting.
So when it comes to my specific day, I work with Jen Woolridge. She's a physical therapist. She and I work together in a team, a collaborative
Okay.
team, and I have a subset of clients that I work with her on, and we treatment plan every
Okay.
week for those individuals. And depending on how they're progressing towards their goals, we modify the program on a weekly basis if needed. But my daily schedule now, I'm only in Beyond Therapy half-time now because I'm half-time in our spinal cord injury research lab. So,
Sure.
but a typical day would just look like hour-long sessions for
Okay.
each individual participant, and we'd just be blocked out, throughout the day, hours at a time. And individuals, so pre-COVID, I'm going to give you the pre-COVID kind of
Sure.
breakdown. That's changed a little bit, but the general model for Beyond Therapy is individuals come in for anywhere between 6 to 9 hours a week.
Wow.
Um,
Okay. Wow.
and those 6 to 9 hours might be broken down generally, usually into 3 days. So they
Okay.
might have 3 2-hour days or 3 3-hour days. We do have exceptions where people spread those hours out over more days, 4 or 5 days a week. But 3 3-hour days is the typical model. And then within any given day, it's going to be a combination of different activities depending on what the person's goals are. But if it's walking function, for example, we have access to robotic assisted technology like Locomat, for example. So body weight
Yep.
supported treadmill systems. We have access to wearable exoskeletons. So the Indigo is one technology that we use, to get people up and walking, especially
Hmm.
if they have, more substantial lower extremity motor impairments and have more weakness. Um, I may see someone that wants to work on their upper extremities. So, that may involve a lot of upper extremity strengthening of a whole host of modalities.
Sure.
I know you mentioned kind of taking sports and athletic and strength and conditioning principles and applying it. And you mentioned, how you thought that was a necessary element of training and rehabilitation. So we absolutely take strength and conditioning principles, athletic training, sports performance, and we just adapt activities
Yep.
for the needs of the individual in the program. So one of the key hallmarks of our program, and one of the things that which is evidence-based, by the way, and I'm happy to talk about this if you're interested, but intensity of training is something that we really emphasize. So it's number of repetitions is good, but we don't just grind out repetitions. It needs to be task specific. It needs
Yeah.
to be intensive.
Yeah.
There needs to be a cognitive load. The person needs to be focused and attentive in the activity, and it needs to be targeting the specific tasks and activities they want to work on. But
Yeah, Nick, you mentioned intensity, right? And you mentioned one sort of analog of intensity, which could be some repetitions per unit time, or movements per time. But are you guys monitoring other things? Do you have heart rate monitors on people? Are you measuring workloads, watts? Depending, I guess it depends on the task, but give me a sense of what you guys are monitoring to help assess whether or not you're delivering a sufficiently hard stimuli.
yeah. So this intensity question is near and dear to my heart at the moment because this happens to be a fairly large piece of my dissertation that I'm working on. So um, and stop me at any point if I'm losing. I know I'm not going to lose you. If for
Yeah,
some
yeah.
reason something's coming out incoherently,
You're
but
quite all right. I'll try to break things down if we need to, Nick, so don't worry.
yeah, okay. So one of the challenges, potential issues with the concept of exercise intensity is that, um, generally speaking, when people are thinking about and talking about intensity um, as a priming strategy or as a strategy to induce some change, optimal change in our nervous system or our
Hmm.
physiology, they're talking about physiological changes. And in order to induce a physiological change, we need to be able to measure we need to have a measure of physiological intensity.
Yep.
So although number of repetitions over time could be a high yield, a high physiological stimulus, it may not. It may be very
Hmm.
low. You can perform many, many repetitions that may be at a suboptimal or submaximal state where it's not very physiologically intense.
Sure.
So we try to, and what I like to emphasize is some measure of physiological intensity,
Okay.
and the best we can do in a clinical setting, I think, and I'm happy to hear alternatives, but it's something like heart rate.
Yeah.
Heart rate, I think, is going to give us a better measure of the physiological intensity of the activity as
Yep.
opposed to just counting repetitions. Although, I mean, I know you know, the volume of training can be intense, can
Sure.
equate to some level of intensity. But anyway, that's kind of long winded. But so when I think of intensity and I think about the physiological mechanisms that we're trying to induce by getting someone to work at different intensities, we need a measure of physiological
Hmm.
intensity. And heart rate to me seems like the lowest hanging fruit, but it has all kinds of challenges. I mean,
Sure.
and we
Sure.
can get into the details of that. But if I had one measure, to gauge how hard my participants are working at any moment in time, I'm going to try to capture heart rate real time during the
Sure.
activity. And,
Sure.
and we can do all kinds of calculations to figure out what the optimal intensity should be for someone. And so we can do that. When they come into the program, we can calculate and estimate either through some sort of testing beforehand or based on age, or
Hmm.
we can calculate a intensity that we feel like would be optimal for that person, and then we try to gauge the activities throughout their training, using heart rate as much as we possibly can.
And you're
Anyway,
using that presumably to then modify the interventions over time. So you're monitoring, presumably you're also continually assessing maybe some change in the needed stimuli, right? Presumably if someone's getting fitter, that necessary stimuli may have to be bumped up. So that's a kind of that continual feedback loop of let's get some more information as we progress, and we'll integrate that into the therapy sessions going forward. I think
yeah,
heart rate seems to be a very very easy one. I think, as you said, low hanging fruit. But there's of course, coming from the endurance athletics background, I know that heart rate can have a lot of baggage. So I
yeah,
much prefer workloads, these sorts of things, power outputs. But those are kind of hard to do with if you're doing upper extremity movement tasks. A little bit
yeah,
more challenging to get assessments of work there. But very interesting.
yeah. I agree 100%. It is very challenging, and I would love to have more robust measures of
Hmm.
overall work and intensity during our training sessions, but it's hard to access that technology. And
Sure.
then the way that you might assess that person might be limited at any moment in time. It would be really nice if there was some biofeedback tools. I mean, I know the technology that you've developed has some really cool integrated sensor
It does.
technology, and you.
Yeah, but it's again it's limited to certain movement patterns, right?
Yeah,
So it gives you a good surrogate for something, but of course it's not an exhaustive list of data points
yeah,
about movement. Um, you almost want to have some three-dimensional model of someone's movement, knowing sort of the weights of their segments, and you can kind of figure out workloads from that. Um, but that's a potentially a problem for a computer scientist, a little outside of my wheelhouse. Let's put it that way.
yeah,
Maybe we can have
yeah,
a
yeah.
collaboration on that.
Yeah, yeah,
Um,
yeah. I mean, we've thought about other things like blood lactate. I mean,
yeah,
that's something that you could capture for sure.
sure.
There's many sensors that you can purchase for quite only a small amount of money, but
Yeah,
then you're poking and pricking people throughout their sessions. But I think that
yeah,
would be super interesting, to do, and maybe it's something you do intermittently. I don't know,
sure.
but it's a
I
hard
was
one.
even thinking about like glucose levels, right? If you use like
Yeah,
taking some inspiration from individuals with diabetes, right? Using a CGM, a continuous glucose monitor, right? You can monitor blood glucose levels as being some surrogate for how much sort of effort they're doing. Of course, it's a little bit confounded too, but that at least gives you some level of their effort. Secondary, but could be interesting to look at there. Um,
yeah, yeah,
hmm.
for sure.
Some interesting thoughts. Very good.
Yeah, yeah,
Um,
I think that would be an amazing area for future investigation or future development. How do
sure.
we optimally quantify physiological intensity during a
Yep.
therapy session?
Yep.
Um, you know, um, where you can overcome the limitations of heart rate or overcome the limitations of measuring forces directly or
Hmm.
work directly. You're limited by
Yeah.
the technology and what it can do, but I think that would be
Yeah.
super fascinating.
Yeah, and of course, all these things also have different time lags, right? Where maybe the force metric is a measure of instantaneous effects that you're putting out, but maybe there are some residual things that happen on the back end once your metabolism catches up, or these sorts of things. So I almost
Yeah,
imagine that we're going to need some sort of composite measure. I always kind of use an analogy of like sort of GPS, right? GPS doesn't work with one satellite, right? You can't know
mm,
where you are on the Earth with one satellite. You have to have multiple ones in order to kind of triangulate the real ground truth position. So I imagine we're going to probably have to have some multimodal approach, or maybe it's some surrogate like lactate, or maybe blood glucose, or heart rate can involve with maybe some kinematic measures and kinetic measures. So
yeah.
yeah, yeah,
Yeah, yeah. The trick is not getting bogged down so much in the actual measurement of what it is that
sure,
you want to collect,
sure,
and then you forget about well, that all might be good, but are we
yep,
actually is that helping us produce a better functional
yep,
outcome?
yep,
We can collect a ton of data and then find out that we're still going to get the same result for the
yep,
individual without all
yep.
that data. So
Yeah,
it's
and leave it to scientists to forget there's an actual person behind all the data, right? That's right.
I know.
So
I battle that all the time. I'm like, oh, this would be really interesting and fascinating to do, and then I'm like, well,
yeah,
yeah, okay, but is that really going to help my next participant?
yep,
Is it going to help me do anything more for my next participant to help them? It's one of
sure,
those things. But but
yeah.
I know you understand and get all that. So.
No, but this is good. This is good, fun conversation. So I want to be very respectful for your time, and so maybe just one final question for you, Nick. Tell me a little bit about what you kind of already alluded to a little bit about your dissertation and what kind of aims you have, what kind of studies you're proposing and actually doing. But tell me a little bit about maybe what's your next kind of 6 months look like? What's your finish line look like for your science, and what project are you working on?
Yeah, yeah. So thank you for that question. A PhD student slash candidate always loves to talk about his own
Oh yeah,
research.
oh yeah, sure.
So yeah, so I've been working on a project that's funded through the Spinal Cord Injury Model System Study. This is funded through NIDLR.
Yep.
And the principal investigator for this study is Dr. Adele Field-Fote. So she also happens to be my advisor for my PhD. She's a phenomenal clinician and researcher, so it's been
Hmm.
great working with her. She knows her stuff for sure. But so I've been coordinating this site-specific project, and what
Okay.
we're interested in is the combined application of an intensive motor skill training circuit. So we
Okay.
devised a lower extremity. We're calling it a locomotor related motor skill training circuit.
Okay.
So these are activities that would be relevant and that we hope are transferable to walking function.
Can you give me an
And,
example of those?
yeah, so it's 6 exercises
Okay.
organized in a circuit. Each
Okay.
exercise is performed 1 minute at a time,
Okay.
and we work from exercise 1 to 2 to 3 and around the circuit. And we have individuals complete this circuit 4 times.
Okay.
And we are monitoring heart rate throughout to ensure that they're achieving at least what we've estimated as a moderate intensity based on a calculation of heart rate reserve, which I know you'd be
Yeah.
familiar with. So anyway, our goal is for individuals to maintain at minimum a moderate intensity
Okay.
throughout the duration of this circuit. And exercises include things like body weight squat. So there's no
Okay.
equipment involved. So we designed this circuit so that anyone could possibly implement it. One of the motivating factors was not to develop an exercise routine that you could only do at Shepherd Center,
Yeah. Yep.
Um, so these are all exercises that can be done in a community-based setting. They could be done theoretically at home if it was safe to do so, or with
Or in a
supervision
gym. Yeah. Yeah.
by a clinician or a personal
Okay.
trainer or physical therapist. But anyway, so example exercises: body weight squats.
Okay.
Um, we incorporated a high velocity movement, so a plyometric jump, which is
Oh,
just
okay.
basically an individual trying to exert and generate as much power as they possibly can in a single vertical motion, and as rapidly as they can. And we can talk about all the nuanced details of how people are accomplishing these exercises if you want. We have a toe tapping exercise, so just ankle
Okay.
dorsiflexion and alternating between left and right sides, and they've got to do that consistently and consecutively
Okay.
for the full minute. We have a multi-directional lunge exercise, so the person
Okay.
has to
Kind of like
move,
clocks going out. Yeah.
yeah, move
Okay.
in different directions, and we have a step tap exercise. So the person has to generate knee, hip, and ankle flexion to lift an alternate leg onto a 12-inch step and back down again. So those
Okay.
are the types of activities. So again, they don't necessarily require any equipment, but they were specifically designed to accomplish a few things, which is one, we wanted it to be intensive to
Mm-hmm.
generate physiological intensity. We wanted the movements to be cyclic, so they have
Okay.
a cyclic nature to them, just like walking does. And then we wanted to try to engage people so they would need to generate a high amount of forces in a short period of time,
Okay.
which we hope is going to, successfully impact and improve walking speed
Sure.
as a measure. I mean, we're capturing many measures, but we're particularly interested in changes in walking speed as a measure of improved walking function.
Okay. Now, is that the main question you're trying to ask is basically, does this intense circuit training program, does this improve walking speed? Because I've talked about it many times, that walking speed is a great predictor of safety in the community, also just of dynamic balance to support all these sort of good things. So is that kind of the leap there you're trying to make, ask that question, does this help with walking speed?
Yeah, that's one
Okay.
of the questions. That's one of the questions. And then we're also adding an interesting piece to this, which is we're adding to the circuit
Mm-hmm.
non-invasive brain stimulation. So we're
Okay.
using cranial direct current stimulation. So it's just a direct current stimulation. And we're stimulating the motor cortex, the leg
Okay.
representation of the motor cortex, and the cerebellum as well.
Mm-hmm.
And so we've got a kind of a positive current, electrical current flowing through the motor cortex and a negative current at the cerebellum. And we're combining this with the circuit, with the exercise circuit, with the idea that the stimulation would augment the effects of the
Sure.
exercise, that we want to
Sure.
be able to produce a greater effect on motor function
Sure.
by adding stimulation. So we actually have two groups. We have one group that just receives the training, the participates in the exercise circuit, and then we have another group randomized to receive the stimulation along with the circuit at the same time.
Okay.
And we're going to compare the groups to see if
Sure.
the stimulation has an effect on training. But ultimately, yes, to your first question, yeah, ultimately, we would love to find out that a very brief, 30-minute exercise circuit is just as sufficient to produce, changes in walking speed, before and after training, as would, many hours of training
Sure.
or, 2 hours of training. So we're interested in finding interventions that can produce the greatest effect in the least amount of time,
Mm-hmm.
with the fewest resources. So yeah,
Yeah.
so that's all right.
No, the economics behind it are really, really important too, right? Because yeah, if we could all do constraint therapy, we'd all be okay, right? We'd all have a much better outcomes. But there just physically are not enough therapists or exercise physiologists to do 6 to 8 hours of therapy a day for the
Yeah,
amount of time that are needed to help all these individuals. So
that's right.
yeah.
Yeah. yeah. It's important to try to get these interventions out of the clinic, if possible, and
Hmm.
into the community so that
Yep.
people can access them after they discharge from rehab, or if
Yep.
if they live in an area that doesn't have a Shepherd Center or a Georgia Tech or a
Yep.
X institution. I mean, you're
Hmm.
doing exactly the same thing with your technology. You're accessing people in their homes, and that's what we need to do, and that's the thing we're interested in with this project. One of the things we're interested in.
Yeah, it'll be interesting to see the next step too, to see if those things change or if you can deploy them in the home environment. Even kind of like a virtual version of this, where you might have someone like you monitoring and being able to help guide them. But it'd be really interesting to see if that translates well to a more of a pragmatic study outside of the clinic, because it's very, very challenging to do those studies out in the real world where
Yeah.
various variables come into play. So be
No,
very
I
interested to
agree.
see the next steps.
Yeah, I agree 100%. Yeah, that would be a great goal. I think that the evidence that we're seeing right now is that the circuit seems to be pretty effective in a short period of
Okay,
time. Not sure about the stimulation, whether this is going to
sure,
be valuable at this stage.
sure,
You know, tune in to be continued. But the exercise does this circuit seems to be fairly effective, at least in the short term. So yeah, I think
okay,
absolutely the next steps would be, if we feel like it is valuable, to then implement it a longer study out in the community would be
yeah.
amazing.
Well, maybe that'll be our next conversation then, Nick. We can hopefully at that point will be Dr. Evans. We can then do a quick follow up on what is the comparison. Do we need to do intensity with brain stimulation, or is the highly intense rehab program sufficient to cause us positive changes? I am very excited to hear the answer to that question. So
Yeah, I'd
yeah,
love to share with you, chat with you. So yeah, absolutely.
very
Let me
good.
know, and I'll come back on.
Okay. Well, Nick, thanks so much. This has been wonderful. I really appreciate it, and want to be thank you for your time and being so gracious with it. So, thanks so much.
Yeah, it's my pleasure. This has been a pleasure chatting with you. Great questions, and yeah, be happy to come back on, chat some more.
Very good. Very good. Thanks, Nick.